All right, guys. Greetings from Atlanta. So I am actually still here, but I wanted to just record a quick voiceover of the ethics lecture. This is the first of the material for exam two, right? So I wanted to go ahead and just record a quick lecture for you guys regarding ethics. We're going to kind of branch out. We've been talking a little bit. We spent the first part of the course talking about validity, right? Particularly validity, reliability, right? Everything that we really need to know to conduct a good study. However, right there's another set of uh, things that we need to be concerned about as well, particularly regarding ethics, right? Because the ethics of our study also make our study, um, not only obviously one that is, you know, not only obviously valid, but this actually also really helps not only with external validity, but the bottom line is that also as researchers, we have ethical obligations to our participants and to society around us. Um, all right, so guys, here's the deal, right? Unfortunately, as we can see, um, we have a very unfortunate history in regards to how we have utilized research in the past. Um, there was a study done in Tuskegee, Alabama, regarding on syphilis actually in military aged men, and unfortunately, there were participants in the study who were Black Americans that unfortunately were allowed to develop syphilis, right, and then treated with a placebo instead of an actual treatment. Um, and so obviously there are also other things that have happened throughout history where research has been used unethically. There are also numerous examples within native populations, both within the United States and Canada, and then also obviously as well during the Holocaust, where German soldiers experimented on Jewish children and on Jewish adults, particularly in regards to twins, and uh, other types of people as well. So the bottom line, right, is that in order for us to conduct research that is ethical and that has the greatest benefit for society, we have to ensure that the rights of our participants um, are maintained throughout the process. And we do so by adhering to certain definitions uh, when we design the study. So the first one is autonomy, right? So autonomy is self-determination, right? And the capacity for individuals to make decisions affecting their lives and to act on those decisions, right? So ultimately, how we would apply that to a research setting is that any person for any reason should be able to leave your study at any time. They should have essentially the self-efficacy uh, and the individual, autonomy and authority to withdraw themselves at any point in time, right? And that has not always been the case with studies that have been conducted. Okay, beneficence. Okay, this is the obligation to attend to the well-being of individuals. So clearly, the any study that we conduct, right, should have a core foundation of beneficence to it, right? The ultimately the intention being to attend to or enhance the well-being of others, right? As we talked about, what is it that guides us as far as creating a good research question. One of those things, obviously, if you remember from the material for exam one, was actually um, identifying something that was going to be beneficial to society as a whole, right? And that goes hand in hand with beneficence. So beneficence, right? The obligation to attend to the well-being of individuals. Justice, okay? This is fairness in the research process, right? Or the equitable distribution of benefits and burden, right? And so we need to make sure that we are not essentially, distributing, uh, you know, risk within a study, based on our experimental design uh, between groups for unethical reasons. For example, ensuring that one group of participants receives a certain treatment within a study, whereas another does not, based on a factor such as race, ethnicity, religion, gender identity, sexual orientation, etc. Right? So fairness in the research process, equitably distributing benefits and burdens. So there are multiple, acts that have actually been um, enacted over time that help us further protect our research participants, right? And many of these have been signed into law, both obviously at a national and international level, right? And so there are several different examples that we'll discuss. So the first one that we often think about, particularly in the aftermath of the Holocaust, was the Nuremberg Code, right? So every patient essentially has the right to informed consent. Obviously, those victims in the Holocaust were not given any form of informed consent, and not only obviously with those that perished in the Holocaust, but also you know the indigenous peoples and many of our black participants that participated in studies. None of these groups were given informed consent, right? And so the Nuremberg Code essentially stated that every patient has the right to informed consent. Not only that, in 1964, right, the Declaration of Helsinki essentially proposed that every research study, that particularly ones that will, perform experiments with human subjects, right, must undergo independent review by a committee. So an IRB committee. We'll talk more about that obviously as well in the coming weeks. But they established criteria that every single study must pass IRB review, right? So the National Research Act, okay, this was a law specific to us in the United States, right? So these are strategies to protect this act, pardon me, uh, essentially provided strategies to protect human subjects, and that this is now standard within the United States, right? So obviously, not only IRB review, but making sure that participants are fully informed um, of the risks and benefits of the studies, but also have have to give informed consent within participation in the study as well. So the Belmont Report, okay, in 1979, and this has a lot of applicability, particularly in regards to drug trials and particularly clinical trials conducted. And approved by the FDA. So the Belmont Report published findings of the National Research Act of 1976, right? And ultimately, it was out of this report that the FDA and the Department of Health and Human Services adopted their standards, not only for research studies, but also for the implementation of research in regards to drugs, various medical treatments that needed FDA clearance, and so on and so forth. And then one that we're the most familiar with up to today, as many of you are aware, as is probably before, maybe within a few years of most of you being born, but the Health Insurance Portability and Protection Act, right? So this is essentially developed uh, a common rule, right, for the protection of subjects and protected patient information, which essentially helped to ensure subjects' anonymity uh, when participating in a study. And not only that, this is also something that we see obviously applied widely in healthcare in regards to the protection of patient information, name, date of birth, address, social, and obviously any link to diagnoses to that individual's personal information. All of those things are protected now by law. So, when we go back and we talk about the IRB review, right, that the that the Declaration of Helsinki put enacted for us, right? We need to look at the components of an institutional review board, right? And so the job of an IRB review committee, right, reviews research proposals to ensure that they meet criteria and that they stay within the bounds of ethical standards, right? So the IRB committee is typically composed of 5 members, right? And this has to include an appropriately diverse panel of people, right? And so ultimately, we want that IRB review panel to be as representative of the heterogeneous population as possible, right? So obviously men and women with the competence to be able to review the proposal that have a background in research. And then there is one member who is generally a public member. This can be generally a lawyer, ethicist, right? Generally, at a previous institution, we had a philosophy professor that sat on the IRB review board to kind of act as a disinterested third party, but to also ensure uh, that there was no risk for bias and or professional uh, interest to color essentially the approval of the approval of a proposal. So there are two types of review that, generally speaking, we provide to studies after they go through IRB review. The first one is expedited review, and those are studies that take place under usual circumstances, using a normal or generally not at-risk population, right? With very, non-invasive experimental procedures. For example, uh, studies were, during the COVID pandemic, studies were essentially granted expedited review, particularly in regards to the development of data for PCR tests and those types of things. Many of these studies were either given, full, expedited review or even exempt review due to the necessity um, that, that was present during the COVID pandemic. Obviously, expedited review, in the event that you're using a very low risk experimental design without significant risk to a population, that generally undergoes review by a committee. However, with exempt review, okay, surveys, interviews, generally speaking, these are not study designs that directly impact the potential safety or pose direct risk to participants, and so many of these studies are given exempt review in this case due to the lack of direct human involvement or direct human experimentation. So obviously, as we know, right, there are various different uh, things that need to be accounted for within a proposal. First and foremost, obviously, as we talked about, every study must have informed consent, right? So informed consent is extremely important because it allows us to document the fact that our participants are actually willingly participating in the study. Right, the risk benefit ratio must remain in balance, so that the apparent risks of a study do not outweigh the benefits and potentially endanger the participants. Obviously, the participants that are participating in the study also must be able to actively acknowledge the purpose of the study and willingly participate in the study. Right. And then standard of care. Oftentimes, when we are doing an experimental study for a new drug or a new treatment, right, we cannot, we are not allowed to place another group at potential health risk, particularly if they have a condition that we are essentially treating for. For example, right, for let's say that we're, testing the effects of a new drug, pardon me, on type 2 diabetes, right? We would not then be allowed to deny the control group, right, metformin or insulin, right, because those treatments are standard of care for diabetes management. So we would not we would not be able to offer them anything less than the standard of care because we would be unnecessarily endangering their health, and any IRB review committee would immediately deny that study because the control group or placebo group is not receiving the standard of care in that case. So obviously, informed consent, right? Information, has to be disclosed fully at the time of the uh, enrollment in the study, right? And the individual's autonomy has to be maintained at all times. They have to have the option to leave the study at any time, right? And any data collected from a subject must be used in a manner specified on the informed consent document. So you have to tell the participant how you will be using the data, and any use of that data other than that expressly written in the study description and in the proposal is unauthorized and unethical. Okay, we talked about obviously the uh, the obligation of beneficence, right? And so we have the obligation to specifically balance out the risks and benefits within a study, to fully maximize the benefits and minimize the risks, right? So we have a moral obligation to patients to ensure that our studies are designed in such a way where they can essentially attain maximal benefit, not just from the experimental treatment, but also potentially from the standard of care as well. So acknowledgement of risks. The subject has to be able to acknowledge that they understand their rights, right? That they are participating voluntarily, and how the data will be used. Obviously, and this is actually also the same thing when we are signing. even with surgery, right? Subjects, can ask questions at any time, and we are obligated as researchers to answer those questions, right? If we're doing studies on minors, those studies will require parental consent. So if we are studying minors, if you're in grad school and you're studying the specific effects, of an exercise program on childhood obesity, for example, you have to have parental consent in order to perform a study on a minor, right? Very, very important that people from vulnerable populations, uh, potentially those that have been historically marginalized, uh, you know, uh, minority populations, um, native populations, those types of populations, uh, may require increased attention and due diligence within the research process, because they may ultimately be more reserved, right? So as a researcher, you may need to do a little bit extra legwork, not only to gain their trust, but to also make sure that risks, benefits, the purpose of the study are fully explained to participants, right? Obviously, personal identifiers and information has to be protected at all times. So, we kind of talked about this a little bit, but clearly in a lot of our experimental designs, we have our experimental group and our control group, right? So the experimental group, as we've talked about, generally receives the intervention of interest or the treatment of interest, right? And there could be a significant benefit, right? Particularly if the null hypothesis is rejected and we actually find that our alternate hypothesis is true, right? Now, here's the thing, like we just mentioned, in a control group, generally the control group in an experimental study, either receives no intervention or placebo. But in a study, particularly in one centered around therapeutic effects of a treatment or a drug, the control group must receive standard of care or the gold standard if the intervention is believed to be superior, right? So we must provide the standard of care or the gold standard to the control group, particularly if there is a presumed benefit to the treatment. All right, so guys, that is the first of our foray into the ethics of research. We'll go into more detail, obviously, later this week. I will record another lecture for you on Monday as well. Hope you guys have a great day and have a good weekend. Thanks, guys.